We are so excited to be able to partner alongside with you for your upcoming joint replacement surgery. Now that you've decided to have surgery, you might be having some fears, anxieties, and questions. We totally get that. That's why we want to give you as much information ahead of time to really bring down that anxiety, answer those questions, increase your level of confidence, decrease your complication risks. We know that providing you more information ahead of time really sets you up for best possible results. We also understand that having surgery coming into the hospital can be a stressful time, and that's why we give you a familiar face to know that you now have a friend here at Meridian Park Hospital. We have a fantastic crew. We have a lot of fun, so come have fun with us. We get to be your guys' biggest cheerleaders from the very beginning. Part of that team consists of orthopedic care coordinators, a group of experienced nurses, kind of like a concierge share hospital stay. We start from the very beginning by meeting with you to provide you with more information to really set you up for best possible results. We follow you through your surgical journey. We meet with you before you even leave the hospital, provide you with more education to really set you up for best possible results. Increase your confidence and make sure that you're ready for your discharge home. We get to be that contact point person, so reach out to us, contact us. We're here with you every step of the way. Our primary goal once you've had surgery is to get you home. We know that home is the best healing environment for you, but we want to make sure that that's a safe destination. So now's the time to really start looking and building that support team. If you don't already have that live-in support person, well, now's the time to start piecing that together. Looking at friends, family, neighbors, coworkers even, making sure that you have a solid crew or team for those first 2 weeks in your recovery process. Know that you can't go at this alone. You're going to need help. Making sure that you're safe, getting up and down to the bathroom, being able to navigate through your home, making sure that you have meals available, transportation, back and forth, doctor, therapy appointments, because typically you're not allowed to drive for the first 2 weeks after your surgery. Some people will go to a secondary destination, a skilled nursing rehabilitation. And basically, it's a short term destination for people to go and really focus on that rehab or therapy to build up more strength, endurance, and confidence to be able to then go home safely. Other ways that we can help make sure that you're in the best health possible is by doing some blood work and EKG before your surgery. Typically, this needs to be done within 28 days of your surgery. If this hasn't happened or hasn't been scheduled, please let us know so that we can help get you scheduled. Now is when we really want to focus on getting you in the best physical shape that we can in preparation for your surgery. Now, don't worry, this doesn't mean that we're going to transform you into something that you're not. This just means we're going to focus on the things that really matter, like good, healthy diet, nutrition, especially those lean proteins in about a week leading up to your surgery. Fresh fruits and vegetables are essential, and hydration is so important for lots of reasons. Number one, hydration by drinking lots of fluids is really going to flush all of those toxins out of your system. It's also going to work to normalize the gut and the bowels because one of the biggest issues, complications, even readmissions that happens after surgery has to do with constipation. Nobody ever likes to talk about it. Nobody ever thinks that it's going to happen to them. But guess what? It's a big issue. We don't want it to become a big issue for you. So that's why our recommendation is for you to start drinking at least 6 8-ounce glasses of your non-caffeinated beverages like water every day. So yes, that means lots of trips to the bathroom. That's the intent because we want to make sure that this doesn't become an issue. So you're going to hear us talk a lot about constipation. I'm sorry, but this is how it's going to help keep you from having problems after surgery. Also, when we think about overall good health, that includes your teeth. Having issues with infection or poor dental care can actually put you at a higher risk for infection. So we do ask that you do have good dental care, making sure that you're current on all of your dental cleanings, checkups. We also ask that you have all of that done about 2 weeks before surgery, and then you will wait an additional 3 months after surgery to have any kind of dental care, cleanings, checkups done after surgery. Smoking can also lead to issues with delayed wound healing as well as respiratory issues, so it is a requirement that you stop smoking before surgery. Also, keep in mind that our facility, this campus, is tobacco free, so you and also any friends, family visitors, they are also not allowed to smoke on site. If you do use any kind of marijuana, THC, CBD containing products, that's totally fine to take up until the night before surgery. You will need to stop. Don't take any of that the morning of. Also, most importantly, don't bring any with you. You cannot have any on your possession. Unfortunately, security will confiscate it, they will destroy it, and you won't get it back. Now is also when we want to start having you have good visualization of your skin, especially the area where your upcoming surgery is going to take place. Very closely monitoring for any open areas or breaks in the skin that could be a potential for bugs to get in. Looking at rashes, ulcers, sores, psoriasis, cat scratch, cat bite, any of those things, if they were to surface, let your surgeon know. Most likely they're going to want to see it just to make sure that it is still safe for you to proceed with surgery. You will hear us talk a lot about prehab exercises, and I think everybody's kind of geared up for the fact that there's some exercises or therapy that you need to do after your surgery. The difference is, instead of waiting until after surgery, we're actually going to shift that mentality and start those very same exercises right now. We're going to instill what we call muscle memory by training you as well as your muscles and your tissues. They will learn what they need to do so that after the insult of surgery, they will fire and engage a whole lot faster. It's brilliant because they remember what it's supposed to do. So therapy will go through all of these exercises carefully with you. The most important thing for you is just to keep moving. Try and do these exercises to the best of your ability. Now, I recognize some of them you may not be able to do, and that's okay. Right now, pain gets to be your guide. Push yourself to the point of pain, and then you can stop. But do the best you can. Keep doing the exercises, even as simple as they might seem. I promise it will make your recovery that much easier, faster, and better. Most importantly, just keep moving. Be as active as your pain will allow. Right now, probably the biggest determining factor that helped you decide to have surgery has to do with pain. And you may be treating that pain with some kind of an anti-inflammatory. Those fabulous Advil, ibuprofen, Motrin, Aleve, Mobic, lots of those out there. They're fabulous for those arthritis type pain. Unfortunately, as fabulous as they are, they can also thin your blood. And so you will need to stop taking those 7 days, 1 week before your surgery. In that 1 week period, when you're not able to take those, a really nice alternative is Tylenol or acetaminophen. Tylenol, when taken consistently, works very effectively to help manage or minimize that pain. If you don't already have Tylenol, we strongly recommend go out and get some. Again, you can get regular, extra strength, arthritis strength, go generic, it doesn't matter, it's all the same. Go ahead and get some Tylenol. Use that before surgery. Make sure that you follow the package instructions of how to administer that. Make sure that you don't take it any more frequently than the package tells you. Also be very aware that a lot of your pain medications, the narcotics, have Tylenol or acetaminophen mixed in that. Be careful, read the labels, make sure that you're not taking 2 different medications that contain Tylenol. If you have any questions, please reach out to us. We'll be more than happy to answer those questions. We also utilize Tylenol in the after-surgery management of pain. So we strongly recommend if you don't already have some Tylenol, go out and get that because you will use that after surgery. We have also included in one of your handouts a thorough explanation of Tylenol, so please reference that for any further questions. Now is also the time that we want to start looking at your home or your living environment to make sure that it's in the safest environment possible. Looking at anything that could potentially trip you up, because around here we consider fall a 4-letter word, and that is not going to happen. So looking at things like bath mats, throw rugs, electrical cords, stuff, even pets, making sure that we clear all of these things out ahead of time to really prepare and set you up for best possible results. Maybe you have those area or throw rugs that you've had for a while. The corners are starting to roll up a little bit. Well, now's the time to tack those down. Or if you can't, better yet, roll them up, get them out of the way, get rid of that obstacle. Also, those pets, as much as we love them, they can also be big time trip hazards. Maybe you have some pet laying on the floor, or maybe you have one that likes to weave in between the legs, rub up against you, also becomes a trip hazard. So thinking about having somebody to be able to make sure that they're out of your way, keep your pathways clear. Knowing that when you go home, most likely you will use some kind of an assistive device, like a walker. That walker will widen your gait. Do you have clear pathways to navigate where you need to? Maybe you need to move that coffee or end table out of the way just a little bit. You also want to be thinking about where you're going to be spending most of the time, or that recovery station. Maybe it's a bed, a recliner chair, a couch, making sure that wherever you're going to be sitting, that it's an area where you can easily get in and out of. Thinking about raising that up just a little bit, making sure you have a firm cushion, making sure that you have good supportive armrest to really push up off of to be able to help you in and out of that area safely. For shoulders, you really want to focus on getting things out from high to reach places down on low, easily accessible areas, because you're not going to be able to reach up and above the head after your shoulder. Also, making sure that you take some time to practice putting on and off shirts, getting some good button or zip up tops that are easy to get on and off. Also, start practicing some good bathroom or toilet hygiene, especially with that non-surgical arm. That will come in handy if you've taken the time to practice that. Also, now is when you want to start thinking about meals, getting some meals prepped and in the freezer, or better yet, let your friends and family know. Everybody likes to help, but no one really knows what to do. That's a fantastic way that people can help by blessing you, bring some food over. It'll really come in handy. Thinking about easy to prepare meals like sandwiches, high protein shakes, bars, high quality snacks. Your appetite will be affected after surgery. You're just not as hungry as you normally will be. So just making sure that whatever you consume counts. So good, high quality, smaller, more frequent snacks are good to have on hand. Also, get some medications, whether they're over the counter, prescription. Get a good supply of those so that you're not running out when you can't get out and drive. You also want to start thinking about getting some ice packs, gel packs, frozen peas, cooling devices, anything cold to be able to ice that joint. Ideally, you want to have a couple of them to be able to rotate and always have something cold. The ice packs and gel packs have come down in price a lot now. You can get them almost anywhere. We've also included in your handouts some really fantastic homemade versions of gel packs. I'll tell you the best one, very inexpensive, easy to use. It's amazing. Who would have ever thought? But all it is Caro syrup, corn syrup. Go to Freddy's, get a $5 bottle of Caro syrup. Pour it into a Ziploc bag. That's it. You don't add anything else to it. Fill up your bag, get all of the air out, seal it, double bag it. High quality Ziplocs, don't skimp on those. Throw it in the freezer. The cool thing about that is when it freezes, it will not get hard. It stays real squishy and pliable, which is fantastic because for shoulders, for knees, you really want it to be able to mold around that area nicely, and it will. And for hips, you kind of want to get it up and under your buns a little bit. You don't want to be sitting on a big ice chunk. It is fantastic. Use it, throw it back in the freezer, continue to reuse it. It's amazing. Cooling devices are great. So if you have access to one or want to purchase one, let us know and we can also help you in that process as well. Think also about any other kind of adaptive equipment that you might be needing. Now is when you really want to start thinking about purchasing those, heading up your Goodwill, Salvation Army, Elks Lodge, senior centers, churches. They're fantastic to get secondhand or cheap assistive devices. Before your surgery, you'll need to have a nice empty stomach. And in order to achieve that, we will ask that you stop eating or drinking anything 8 hours prior to surgery. Typically, they'll just say before midnight the day before, but usually it's 8 hours before your surgery time. You stop eating and drinking anything. That also includes medications. So typically the morning of surgery, you will not take any of your routine oral medications. We've included a handout with a full listing and explanation all the medications to take or not to take the morning of surgery. In general, you don't take them. However, a couple exceptions to that. If you take any blood pressure medications, you will not take those the morning of your surgery. However, if you take a medication like a beta blocker that controls the rate or rhythm of your heart, that one you will take in the morning with just a small sip of water, just enough to get that down, and that's it. If you're diabetic, please refer to that handout for the very specific protocol to follow. You will also need to stop taking any blood thinning medications before your surgery. We already talked about those non-steroidal anti-inflammatories, or the NSAIDs, that you will need to stop taking a week beforehand. Now also, any other medication, even as simple as a baby aspirin, a full adult strength aspirin, or anything stronger than that, Coumadin, Pradaxa, Eliquis, Lovenox, Xarelto, lots of blood thinners out there. If you are on any of those medications and no one has instructed you of when to stop taking those, please contact your surgeon and they will tell you the exact date to stop taking before your surgery. We also advise you to stop taking all vitamins and supplements a week before your surgery because a lot of those can also contain blood thinning properties. Especially your vitamin E, your fish oils, your turmeric, your ginkgo biloba. Those will thin your blood, so you will need to stop taking those. Another way that we can help minimize your risk for infection is by having you do a skin cleansing process a few days before your surgery. We have provided you with all of the necessary equipment for that. It will contain 2 bottles of chlorhexidine cleansing solution that comes with a mitt, full step-by-step instructions. You don't need to go out and purchase anything. Everything is included. I'll go ahead and walk you through that process. Starting 5 days before your surgery, you will need to stop shaving the low legs beforehand because anytime you shave, there's always that possibility of a micronick, abrasion, a cut that could put you at a higher risk for infection. So no shaving 5 days before your surgery. Starting the evening before your surgery, you will shower and wash your face and your genitals. So you wash your face like you normally do, shampoo, conditioner, whatever you do to your hair, cleanse your genitals. Fully rinse and then step away from the spray or turn off the water. You'll take out your bottle of your chlorhexidine gluconate solution and your mitt, and you'll pour some of that and be liberal. Pour that onto the mitt. Go ahead and turn the water back on. Get that nice and wet. Get it into a nice lather. And basically from the neck down, you're going to wash your entire body, being careful to get everything, getting underneath skin folds. So wash everything from the neck down. And then you're going to fully rinse. And then you're also going to pour some more of that onto your mitt. And you're going to do a 3-minute isolated scrub to your surgery area. Be liberal, cover the entire area, whether it's shoulder, hip, knee. You're going to go for 3 minutes. It's not okay, you're taking off the top layer of skin. It's just a gentle rub to that area for 3 minutes. And then you fully rinse, get all of that off. You dry off with a freshly laundered clean towel. Get dressed in freshly laundered clean jammies. Go to bed in freshly laundered clean sheets. Sensing a pattern? Yes, lots of laundry before surgery. Now, here's where coaches, significant others, you guys get to take one for the team because you guys also, the night before surgery, get to shower. You don't have to use the special chlorhexidine solution. You just shower like you normally do. You just want you clean. And you guessed it, you're also going to dry off with a clean towel, get dressed in clean jammies, go to bed in clean sheets. period. Unfortunately, if you share a bed with a pet, we strongly recommend pets do not sleep with you before your surgery, especially once you have gone through it and laundered all of your bedding or linens. They get a nice comfy bed made elsewhere. They don't sleep with you beforehand. Okay? Now, the morning of surgery, you will wake up and you will repeat the exact same process. You will shower, wash your head, face, shampoo, conditioner, whatever, wash your genitals. And then you also will do from the neck down, the whole body with your chlorhexidine gluconate solution. And then again, another 3-minute gentle scrub to your surgery site. Fully rinse, dry off again with a clean towel, get dressed in clean clothes, come to the hospital. If you have any questions at all about this process, refer to the handout or call us and we'll be more than happy to walk you through that process. Also, the morning of surgery, you will come into the hospital wearing clean clothes. We also ask that you not wear any scented anything. So especially after you have showered and are clean, you will not wear any scented lotions, powders, deodorants, perfumes, hairspray, aftershave. No scented anything. You're literally coming in all natural. So no scented anythings. We also ask that you not wear any makeup, mostly because we want to have good distinction of color, and if you have lots of heavy makeup on, we can't tell, number one. Number two, sometimes heavy eye makeup could get into the eyes, causing a big irritation, or even worse yet, maybe you have false eyelashes. A lot of times they will tape your eyelids closed during surgery, and heaven forbid, may you have those false eyelashes on and we go to take that tape off and there goes your lashes and lots of money with it. So no makeup the day of surgery. Also, all jewelry needs to be removed, especially wedding rings, bands. Those need to come off as well. You're still married. After surgery, you can put it right back on. But sometimes during surgery, you can have some swelling in the hand. And if that's the case, we would have to cut that ring off and it's not very pretty. So leave all jewelry off. You don't need it here anyway. Leave it at home. Put it on after surgery. So what do you pack for your surgery? Hopefully your surgeon has already set you guys up for the fact that you guys are not here for very long. Most of you will end up spending the night and go home the following morning. So because of that, you don't have to bring a whole lot of stuff. You're going to be coming into the hospital wearing clean clothes. They're still clean, so you can wear the very same clean clothes home. Be mindful of your clothing selection. Be sure to choose things that are easy to get on and off, especially for knees, something with a little bit wider leg that you can easily get up and over that leg. Again, for shoulders, making sure that you have shirts, either a button or zip up top that you can easily put on. You don't really want to have anything that you have to pull up and over the head, so easy to get on and off clothing. Also shoes that are comfortable, easy on and off, but aren't going to be a trip hazard. So be thinking of those kinds of things. Also bring in all of your toiletries, dentures, glasses, hearing aids, whatever you need to be able to see, hear, or chew, bring it with you. We do ask that you leave all of your medications at home. Allow us to administer every medication that you will need here in the hospital, mostly because we just want to keep you safe and we just need to know what medications you're taking. If you're taking things that we don't know of, there could be an interaction and we just want to make sure that we keep you safe. There are a few exceptions to that rule, however. If you take any prescription, inhaler, eye drop, or medicated creams, ointments, lotions, those are considered specialty items we may or may not have in stock. It'll take us 24 hours to order and get those in. You guys are in and out so fast, we may not be able to have those. But if you do utilize those, bring them with you. When you check in, let the nurses know. They will label them okay for use, you'll use them, and they will go home with you. But leave that big Ziploc bag of all your pills, leave all that stuff at home. If you use a CPAP, BiPAP machine for your sleep apnea, please bring that with you. We will utilize that, especially after having had anesthesia. Make sure that you bring that with you. We do have them available here. However, there is a rental fee involved, so it's in your best interest just to go ahead and bring yours with you. Go ahead and bring in any of your adaptive or medical equipment like your cane, crutches, walker, cooling device. Go ahead and bring that in, especially the adaptive equipment. The therapists like for you to bring that in because then they can match that to your height. Make sure that it's set correctly so that you're walking properly with that and that you're comfortable knowing how to utilize that. We do have all of those here, so you can utilize ours. It's just nice if you bring yours in, again, just to make sure that it is of the correct height. The day of surgery, you will arrive here at the hospital and enter at the main entrance. You will check in there. There you will receive an armband. They will put you in a wheelchair and you will be escorted down to the short stay unit. And that's where you will get prepped and ready for your surgery. If you have anyone with you, they will be allowed to go there with you and stay through that entire process if you want them to. Up until the point that you get wheeled off to surgery, they will get escorted to that surgery waiting area. In the short stay area, you will be prepped for surgery. They will start by changing you into one of our hospital gowns. The nice thing about these gowns, it's a heated gown. So we have heaters that will plug into that gown and it blows nice warm air. Most people find it very soothing, so we think of it as like a spa-like experience that we give you these nice heated gowns. But studies have actually shown that if you have big fluctuations in your body temperature, it actually increases your risk for infection. So not only does it feel fantastic, but we're also working to minimize or decrease that risk of infection. They also will start an IV, probably in the hand or the arm. Remember when I said hydration was really important? Well, here it is again coming into play, because if you are well hydrated, guess what? It makes it a whole lot easier to find those nice, plump, juicy veins. So drink lots of water before you come in. They will also do another surgical skin prep while you're here in the hospital. If you have any shaving or clipping that needs to happen, they will take care of that in a sterile environment. They will also have you wear some compression boots or SCD, sequential compression device, because you guys are at a higher risk for forming blood clots. Anytime blood isn't actively flowing, it could pool and form a clot. We do a lot of preventative measures to minimize that risk, and one of those are with the SCDs. And basically, it's a wrap that gets placed on both low legs, and it just gently, sequentially squeezes the leg, keeps that blood flow moving in the legs, simulates as though you're up and walking. Anytime that you're here in the hospital and you're not up and moving and walking, those will be worn. Some surgeons also have you wear the compression socks or stockings. Those are those long white socks that compress. They also increase that circulation in the legs to help with blood flow as well. You will also be seen by your surgeon one last time, so if you have that, oh gosh, I totally forgot to ask him question, you get one last chance. They will come in and answer any last minute questions, but they will also do what we call that site verification. And I know it's gonna sound crazy, but they will come in and ask you, can you tell me your name, what surgery you're having, and they will also verify the site and side that your surgery is going to take place. You will verify with them. They will initial that side so that we don't inadvertently do the wrong side, because that's not going to happen. We're going to keep you as safe as possible. Also, your anesthesiologist will come in and visit you. They will review your past medical history, including medications, surgeries, or any other past medical history that's pertinent. It used to be that they would call you the night before. That doesn't always happen, so don't anticipate that. Usually that happens now in that short stay holding area. However, if you would feel more comfortable having a conversation before your surgery, please let us know so that we can help coordinate that for you. Typically, your surgery will last anywhere from an hour and a half to 2 hours. From there, you'll get moved into the recovery room where essentially you wake up from the anesthesia. Typically, you're there for another hour, hour and a half. So if you have someone in the waiting area, just let them know that that's the time frame to anticipate. In the recovery room, know that as you wake up, you will be hooked up to a lot of different things. All of those things can and will make noise, so be prepared for lots of different sights and sounds. You will have that cuff on your arm that will automatically squeeze and inflate. Will continue to check your blood pressure. Most likely you will have some oxygen in your nose, which also means you have the oximeter on your finger. The good news is that it's a high-tech sensor now, and that means you do not have to remove your polish, your shellac, your artificial nails. If for some reason they can't get a good reading on your finger, well, we can also go toes, nose, earlobe, or forehead, so we can get you one way or the other. Also, that urinary catheter or that tube that drains your bladder, we have mostly moved away from the use of that, mostly because you simply just don't need it, number one. Number two, it also can put you at a higher risk for infection. Like I said, you typically don't need that, but the good news is that when you need to get up to go to the bathroom, guess what? We have to get you up to go to the bathroom. It's great motivation to get you out of bed. That's usually the first trip, getting you up and out of the bed to go to the bathroom. It's what we like to call therapy by getting you up and moving. Also, you will have the compression socks or stockings, like we talked about, the SCDs that will gently squeeze those legs and really help encourage that circulation in your legs. As you can be thinking about it, you can also be doing some ankle pumps or ankle rolls that also will encourage that blood flow back to the heart and help keep that circulation moving. It's not typical that you start having pain right away, but if you do, absolutely let them know so that it can medicate you and keep that pain level down and manageable. Know that it's very typical to wake up from anesthesia as though you've had a really good nap. There's a really wide spectrum of how people can wake up. Trust me, we've seen it all, but just know that typically you wake up as though you've had a really good nap. After the recovery room, you will be moved up to the 3rd floor, and that's when the real work begins. We get you up and moving as quickly as we can. If you have any friends or family that have been waiting, we do ask that they just give us a few minutes to get you settled in your room, because remember when I said that you're hooked up to a lot of things? It takes us a few minutes to get you hooked back up to those things, and especially if you're painful, we want to be able to get at you, to medicate you, keep you comfortable, and then I promise we will allow friends and family to come in and see you as long as they are healthy. Keep in mind that you are not sick. We do not want to get you sick. So anyone coming to visit you, they just need to be in good health. Also, any friends or family, just know that we do have visiting hours. The front doors will lock at 8:30 p.m. Visitors can come in later than that if they would like to. They just need to know to come in through the emergency department, check in there, and they will be escorted upstairs to see you. If you have anyone that would like to spend the night with you, that is also an option, but I would strongly recommend, if you can, go home, get a good night's rest at home, come back in the morning nice and refreshed. But if you would like to spend the night with them, maybe you've been married for 40 years and you've never spent the night alone, I get that. Let us know. We will pull in a cot, a recliner, make it as comfy as we can. Some of the ways that we can help minimize risk of complications for you is with the use of hand washing. Super simple. That's probably the easiest and number one way that we can help minimize your risk for infection is by ensuring that we have good hand washing. Every single person coming into your room needs to be washing their hands. We have sanitizer inside, outside every single room, so every staff member needs to be washing their hands. Also, friends, family, visitors, they're probably not going to be in the habit, so you just need to let them know, remind them, everyone needs to wash their hands to keep you as safe as possible. We also want to incorporate that for you, making sure that you start washing your hands now to really help minimize your risk for infection by not allowing you to get sick. That's going to prevent you from getting sick, number one. Number two, that's going to instill good, healthy habits so that after surgery, you're going to be in the habit of washing your hands so you're not going to be spreading yuck to those fresh surgical areas. Other ways that we can help minimize your risk for blood clots after surgery, we talked about the SCDs, the compression stockings that some surgeons use, doing the ankle pumps, ankle rolls. We get you up and moving right away because there's no better way to get that blood pumping than by getting you up and moving. And then also, all of you will be on some kind of a blood thinning medication to help thin your blood to minimize that risk. Depending on your surgery, depending on your past medical history, depending on your surgeon's preference, will dictate what medication that is. That will be reviewed with you after surgery. Pneumonia can also happen after surgery because we've suppressed your drive to breathe. And in some cases, those sacs in the lungs can start to deflate or maybe even fill with fluid, causing pneumonia. So the best ways that we can help minimize that risk is to incorporate what we call pulmonary toileting, or having you do cough, deep breathe, using the incentive spirometer. And basically that's a tool that we will use at the bedside to encourage you to do those nice deep cleansing breaths, forces those lung sacs to stay open. It also encourages you to blow off any of that residual anesthesia. Also, by getting you up and moving and walking, that also incorporates those nice deep cleansing breaths and expanding those lungs. It also helps with pain management by doing some deep breathing, by getting up and walking. That also helps minimize pain. Keep in mind that you guys aren't sick. You have a crummy joint. We've now fixed that. You're not sick, so don't expect to be treated as though you're sick when you're here in the hospital. And one of the ways that we can help encourage that is by getting you changed into your own clothes as quickly as we can. Because something magical happens in the brain. The minute that you put a hospital gown on, suddenly you become sick, and you are not. So we will try and get you changed in your own clothes as quickly as we can to help get you up, get you moving, and get you out of here. Let's talk about pain, probably the biggest fear and anxiety producing element of your surgery, but there's some really fantastic news. The good news is that we have changed the management and the mentality of how we treat your pain. We've come a really long way with the cocktail that we use in anesthesia. They've really fine-tuned that over the years to really make that effective to manage your pain. We also use a lot of different medications. Multimodal approach is what we use to help manage or minimize that pain. We also use some non-medication techniques to work to manage that pain, starting with breathing techniques. Ice, don't underestimate the power of your ice. Elevate. Activity, as counterintuitive as it sounds, by getting you up and moving and putting weight on that joint, it actually helps with pain. We know that the more weight that you can put on that joint, it actually stimulates bone growth, meaning your bone is going to adhere to that new prosthetic. You're going to heal faster and have less pain. So we try and get you up and moving as much as we can. Also, keep in mind that your joint, your body is designed to move. It wants to move. The longer it sits, it stiffens, it gets sore and becomes painful. Motion is lotion. Keep you moving as much as we can to help minimize that pain. As far as the medications, we start with simple Tylenol, acetaminophen. Around the clock, Tylenol consistently helps to minimize pain. If you can tolerate anti-inflammatories, we get you back on those after surgery as quickly as we can. That also works and targets different avenues of pain. And then lastly, we do narcotics. That's that last layer of defense. When you have that acute type pain, that's when we use those narcotic medications. So all of these things that we use works very nicely to manage your pain. We talked about the mentality of how we treat your pain. It used to be that we would rely very heavily on a number scale. We would come in and ask you to rate your pain 0 to 10. 0 is no pain, 10 worst pain imaginable, like someone's taking a chainsaw to your leg, that's a 10. You would give us a number. Depending on that number, we would then medicate you based on that with a goal of getting you down to a 2 or a 3 or a 0. Keep in mind that that is not realistic. Having no pain at all is not realistic pain management. We've come to learn over the years that not all pain needs to be medicated. It's okay to have some pain. So our goal is never to get you to a 0. Our goal now is to get you to what we call a functional level of pain. So what that means or looks like is, can you functionally bear weight on that joint? Can you get up and walk and participate with therapy? Can you carry on a conversation? Even though you might be rating your pain level high on that pain scale, if you can functionally tolerate that, we call that a win. That is our goal. Now, on the flip side, if your pain is limiting your abilities to get up and function, well, that's when we need to relook at what we're doing to manage your pain. Maybe we need to increase the dose, increase the frequency, or maybe we need to scrap it all together and try something different. If that's the case, you need to communicate with us. If you don't feel like your pain is being well managed, we need to know that so that we can work with you to get that pain level down. It's also very typical in the next couple days after your surgery for you to start experiencing more pain. That's part of the normal healing process. That's why it's very important that we find that right cocktail that works well for you, because as you leave and go home and your pain level starts to increase, we want to make sure that whatever we're using will help manage that. Also, here in the hospital, we have a big whiteboard in all of the rooms, and we will write down all of the medications that we're using to manage your pain. We will write down the name, the dose, when you have had that, and when you are due to take that again. So that really involves you in that process so that you fully understand that and that you can carry that same schedule routine when you go home, and that you will follow that to keep up on that pain management. Be sure to take the pain medications as you need to keep moving. We need you to keep moving, stay active. It will allow you to heal faster. Before surgery, we made sure that you had a nice empty stomach. So I know that after surgery, as you wake up, your stomach is still empty. We will feed you, I promise. We just go slowly. Keep in mind that your stomach, your gut, can be the last thing that wakes up from anesthesia. And if we let you have that delicious cheeseburger and fries that you might be craving, it might not taste so good coming up the second time around. So we will feed you, but we take it slowly. We will get you up and moving as quickly as we can safely, and a lot of times that happens within a couple hours of your surgery. We will start that process slowly by sitting you up in the bed, and if that goes well, if you're not feeling dizzy or lightheaded, then we have you dangle, meaning that legs hang over the edge of the bed. And if that goes well, then you can stand. Put a little weight on that joint, and if that goes well, then you get to go for a walk with therapy. And if that goes well, in some cases, people will go home the same day. If that's the case, if you're feeling on track, or maybe you've had that conversation with your surgery that your plan is to go home the same day of your surgery, please let us know so that we can help expedite that process, because there's a lot of information that needs to happen in a short amount of time. It's also very important that your caregiver, support team, whoever is helping you out at home, that they are present here in the hospital. They don't get to just drop you off for surgery and take off and go shopping. They need to stay here because we're going to put them to work doing a lot of training and education with therapy, the nursing staff, to make sure that they are well prepared to help you in your recovery process at home. Most people end up spending the night and go home the following morning after surgery. Typically, sometime in the afternoon, the therapist will come in and they will put a sign in your room that gives you a scheduled therapy time that following morning. That time is very important for you as well as your support team to know, because they need to be present at that time so that they can be involved in that training process to make sure that they're comfortable helping you in and out of bed, up and down to the bathroom, in and out of tub, shower, being able to navigate up and down stairs, and most importantly, being comfortable helping you with whatever kind of assistive device that you have. For you, it's important because you need to have whatever you need done in the morning to be able to do your therapy session, whether that's get up and go to the bathroom, brush your teeth, have breakfast, have a pain pill on board. Make sure that you have pain pills on board to allow you to do more with less pain. While you're here in the hospital, we want to keep you as safe as possible, and that's why our rule is that anytime you're up and out of bed, someone needs to be with you. You can't go at it alone, so that's why you will need to call and wait for help. Should you forget, that is why we have these fabulous tattletale alarms installed on all the beds. So should you forget, alarms will go off, nurses come running in, probably shaking their finger at you, telling you get back in bed. So you have been warned, you do not get to get out of bed by yourself. Also, keep in mind that as you come into the hospital, there's not a lot of privacy that happens, meaning that when you go into the bathroom, yes, that means that someone typically goes in there with you, especially shortly after surgery, because you are still under the effects of anesthesia. Maybe you have some narcotics on board. It doesn't take much for you to throw yourself off balance. Maybe you trip. You do not want to fall. That is not an option. We are not going to allow that to happen. So that's why we keep you as safe as possible. We stay close by. When you go home, we also ask, at least for those first 48 hours, that same rule applies. Anytime you're up and moving, someone is right there with you. Even with your walker, cane, crutches, someone is right there with you to keep you safe and steady. In order for you to go home, there will be several things that we need to check off of that list. First of all, education. We have some discharge education that we will provide with you and your support team before you leave the hospital. We offer that in the form of a class or a DVD or a YouTube video link. The class we offer every day at 11 o'clock, so typically you have surgery the following day at 11 o'clock. You and your entire support team, whoever that is, attends the class. You will listen, receive the information. You will also be sent home with a packet of all of that in a written format before you leave the hospital. If you're not able to attend the class, or maybe you have a caregiver that isn't able to, like I said, we also have that available on a DVD or a YouTube video link that you can access anytime. Also, in order to be able to leave, you will need to be able to eat and drink without becoming nauseous. You also need to be able to manage your pain on only oral medications. We also need to make sure that you're able to urinate and empty your bladder completely or efficiently, because in some cases, the medications, the anesthesia can make that difficult to empty the bladder completely, so we just need to make sure that everything is functioning properly. You also need to be able to be cleared by both physical and occupational therapy, saying that you are safe to get up and walk, to be able to navigate stairs if you have them, that you know how to get in and out of tub, shower safely, and that your caregiver support team also feels comfortable helping you with these things. We've provided you with a lot of information for going home, but you may still have questions or concerns once you're home. Please feel free to reach out, contact us or your surgeon for any questions. Make sure that you have your follow-up appointment established and that you know what time that is. Be sure and ask for help when you need it, because you can't go out this alone. Make sure that you keep safe. Your safety is your #1 priority. Know that bruising and swelling are typical after your surgery, and sometimes it can take a few days for the bulk of that bruising or swelling to surface. So don't be alarmed if all of a sudden you have swelling or bruising all down your arm if you've had your shoulder replaced. Sometimes that bruising can migrate down into the chest, sometimes down into the back. It is all fair game. You can even have bruising down into the hand and the fingers. For hip or knee surgery, your whole leg is fair game to bruise or swell. And like I said, some days it can happen all of a sudden, so don't be alarmed. It's all normal. Some of the ways that we can help to minimize that swelling is with the use of ice. Again, do not underestimate the power of your ice. Go out and make your ice packs, gel packs now. Have them in the freezer, ready to go. We will do a lot more education in that discharge teaching class of exactly how and when, but typically we like you to be icing for about 20 minutes at a time, several times a day. So get in a good habit of that. You're going to be doing this a lot in your recovery process. Also, elevation, very important to allow all of that blood flow to return back to the heart. Keep in mind that to be successful in elevation, that needs to be at least above the level of the heart, if not higher. So that is why you will hear us frequently talk about keep your toes above your nose, because sitting out straight with that leg is not elevating. It has to be much higher than that. Again, we will go into a lot more detail in that discharge class of what that looks like. Now is also a great time to invest in some pillows, wedges, or supports to really help elevate that leg as much as possible. For shoulders especially, you will most likely have a sling to help support that arm. But it also helps to have several pillows strategically placed to be able to help elevate, support that arm so that it really helps minimize the swelling and discomfort for you. Remember I told you we were going to talk a lot about constipation? Well, here we are one more time. Know that all of you will be on some kind of a stool softener laxative combination after your surgery because we've given you anesthesia that shuts down your gut. We then throw narcotics on top of that. Slows down the gut. You're not up and moving around like you normally do. That's like the trifecta, the perfect storm for constipation. That is why we talk a lot about it. We want to get in front of it as much as possible to really minimize that risk. So by doing the combination, stool softener laxative will help minimize that risk for you. It's very important that you do the combination and not just a stool softener because a stool softener in and of itself not going to be terribly effective. You need that combination. Our goal after surgery is for you to have a bowel movement at least every 3 days, so we utilize these medications to achieve that. We've also included in your handouts the prevention and management tip sheet of constipation, and you can refer to that for the over-the-counter medications that we recommend, whether it's pericolase or the Senecot S. You can get these almost anywhere. Go cheap, go generic. They're all the same. You may even consider taking them a couple days before surgery to really ensure that you get those bowels moving and that you have a good bowel movement before you come in for surgery. Know that you will be on a blood thinning medication after surgery. Typically that's aspirin, but again, that will be reviewed with you after surgery. Your surgeon has chosen a bandage that's appropriate for your incision after surgery. The good news is that most of those are considered to be waterproof. Also, you do not need to go out and purchase any wound care or bandages for your incision. We will instruct you on exactly what that wound care consists of and when you're able to shower after your surgery in that discharge teaching. After your surgery, keep in mind there will be some consideration of the clothing that you choose to wear. Like we talked about for shoulders, you would really want to invest in either some button zip-up shirts or even something a couple sizes larger that are a little bit easier to get on and off, avoiding anything that you have to pull up and over the head. Also for hips, know that that incision can be down in the low hip or bun area, and you want to make sure that you don't have anything with a tight elastic band, whether it's your pants or even your underwear, that could potentially rub or dig into that incision. Wouldn't be very comfortable. So you want to rethink those. Also be thinking about your underwear, something that's a little bit looser, longer, baggier, whether you go boxers, boy shorts, no shorts, totally up to you. Whatever is most comfortable for you, just start thinking and preparing for those things now. We have provided you with a lot of information for your upcoming surgery. Our hope is that we have been able to empower and encourage you every step of the way. If you ever have any questions, please reach out to us. We're here with you every step of the way.